Thank you for joining us for the 2024 White Coat Ceremony. Out of respect for this special ceremony, please take the time now to silence your cell phones. In addition, we ask you to remain seated when the students come up to receive their white coats. A professional photographer will take photos of each student, and we will make the photos available to the students at a later time. We sincerely appreciate your cooperation. Enjoy the ceremony.
everyone, and welcome to the 2024 White Coat Ceremony. We are here today to celebrate and honor the Doctor of Pharmacy class of 2028, the Occupational Therapy Doctorate class of 2027, and the Chan Family Master of Science in Physician Associate Studies class of 2025. I am Megan Prosser, Provost and Vice President here at KGI. I want to express my heartfelt gratitude to all of you for being here today. A special welcome to the families, friends, and esteemed guests gathered here to support these future healthcare leaders. Furthermore, it is our privilege to acknowledge the presence of the distinguished members of the KGI Board of Trustees and the dedicated faculty and staff who contribute to the excellence of our institution. At this time, please rise as we welcome Vincent Bryce from the MSPA class of 2025, who will sing our national anthem.
All right. Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars shine through the perilous fight? O'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof, I said it gave proof, through the night, that our flag, it was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Thank you so much, Mr. Bryce. I didn't know we were coming for a concert today. Now, everyone has already taken their seats, but we are going to welcome Reverend Joel Daniels from the Claremont College's Office of the Chaplains, who will deliver the invocation.
Thank you. And I can't believe I have to go next, but here we are. On behalf of the Claremont College's Spiritual Life Office, I want to thank you for allowing me to participate and to congratulate everyone on reaching this very significant moment in your educational journey. As I reflected on this ceremony, I was drawn to a value that pervades all religions and spiritualities, which is truly at the heart of them all. Do to others what you want done to you, and do not do to others what you do not want done to you. It's quite remarkable that this sentiment, sometimes called the Golden Rule, is ubiquitous across all religious communities. That makes this moment and rite particularly divine, if you will. Accepting these white coats launches you into a career. Your life has been leading up to this moment, and while there is still much to do, the end is in sight. Soon you will transition from student to practitioner. As someone who went to school for more years than I can count, it is nice to enter a new stage and to show your family and friends that you, in fact, are not a professional student, which is okay too. But you're heading toward more than a job. You have chosen to help others in the way you want to be helped, while also promising to do no harm. Thus, this white coat you're about to receive is not simply a fashionable top, though clearly it is. The coat is also not only about gainful employment. These white coats symbolize your sacred calling. By caring for others across your diverse fields, you represent and embody physical, emotional, and spiritual compassion, bringing healing and life to people in need. I'll leave you with a quote from the great Sufi mystic Rumi. "There is a candle in your heart ready to be kindled. There is a void in your soul ready to be filled. You feel it, don't you?" May this sacred ritual kindle the fire in your heart and fill your soul, enabling you to overflow in love and compassion to all those in need. Amen.
Thank you so much, Reverend Daniels. I'm now very happy to introduce and welcome our new president, Dr. Mohammed Abu Salam, to the podium to share a brief welcome.
Wow, what a great day. Another applause. Good afternoon, everyone. It brings me great joy to be here with you today for my first white coat ceremony since I joined KGI back in July. It didn't take me long to realize what a special place KGI is, and I am excited for what is to come in the years ahead for the institution and for each of you. I will have more to share a little bit later, but I want to highlight that today is a wonderful achievement in what I know will be a fruitful journey as you become the leaders in healthcare who will uplift and heal our communities. Now I am privileged to introduce Dr. Ross Grossman, the chair of the KGI Board of Trustees.
Thank you. On behalf of the KGI Board of Trustees, I'd like to welcome you to our white coat ceremony. Today represents the beginning of a transformative journey for all of you, for the PharmD class of 2028, the OTD class of 2027, and the MSPA class of 2025, who are now an integral part of our KGI community. I want to take a moment to thank the families and friends gathered here today. Your support has been critical to guiding these students to this day. We understand that choosing a professional graduate school is a significant decision, and we're grateful that your students selected KGI for their path to becoming healthcare providers. Your faith in our institution is appreciated and inspiring. Students, as you step onto your educational and professional path, you are joining a profession with great opportunities and great possibilities. I'm confident that KGI will equip you and provide a solid foundation for your career aspirations. The white coat ceremony marks the beginning of an essential phase in your professional journey, and I extend my heartfelt congratulations to each of you. I'd now like to welcome back to the podium Provost Prosser for the presentation of the School of Pharmacy and the School of Health Sciences.
At KGI, our exceptional administrators, faculty, and staff are dedicated to providing our students with the best possible guidance and support throughout their time at KGI to ensure their success in the classroom and beyond. The School of Pharmacy and the School of Health Sciences are each dedicated to the education of innovative healthcare professionals who will serve the needs of individual patients, the healthcare system, and the bioscience industry. Our programs emphasize interprofessional collaboration, systematic problem solving, the safe, efficient, and ethical use of technology and biotechnology, and personalized patient care. The white coat ceremony holds significant meaning as a symbolic rite of passage. It signifies the beginning of our students' healthcare journeys, their solemn commitment to their respective professions, and the noble mission of patient care. Students, all of you are gathered here today. You represent the future of healthcare, and we count on you to take advantage of the many opportunities in healthcare today to make a positive impact in your community. Over the next few years, you will acquire the knowledge and skills necessary to advance the health and well-being of patients and the overall community. You will collaborate with interprofessional healthcare teams and work alongside other healthcare professionals to find the best solutions to healthcare challenges. As you embark on this phase of your professional journey, we hope you will always remember this time-honored tradition to maintain your commitment to your profession. We're now going to have our distinguished speakers, and we're actually going to go through we're going to start with our School of Pharmacy, and then we'll go to our School of Health Sciences. So we're starting with School of Pharmacy. I'm pleased to introduce our distinguished speaker for the School of Pharmacy, Dr. Paul Nguyen. Dr. Nguyen is an area healthcare supervisor for Walgreens with over 25 years of experience at Walgreens, who is passionate about student and pharmacist development. He has held pharmacist, pharmacy manager, pharmacy human relations specialist, and district pharmacy supervisor positions. In his current leadership role as area healthcare supervisor, Dr. Nguyen is part of a team that supports district managers and drives healthcare programs and initiatives in the Southern California market. His responsibilities include talent acquisition and development and providing guidance to improve the overall pharmacy operation and patient experience. He serves on the Dean's Advisor Council at Western University of Health Sciences, and on the Experiential Education Advisory Committee for Chapman University, and on the Walgreens Dean Advisory Council, which is a consortium of 17 deans from 17 pharmacy schools across the nation. He is also an adjunct assistant professor for KGI, Western, Ketchum, Chapman, and UCI. Dr. Nguyen is a valued partner and colleague that has been supporting the KGI Doctor of Pharmacy program, its students and graduates for many years. We're grateful for his partnership. Please join me in welcoming Dr. Paul Nguyen.
Thank you, Provost, for the very kind words. I'm honored to be here today, and I'm thankful for our collaboration, friendship with KGI. Good afternoon. To the parents, relatives, friends, supporters, I carry the same admiration as you do for the talented students in the healthcare programs at KGI. But without your support, encouragement, guidance, and influence, these students would not be here today. Thank you for cultivating the next generation of healthcare providers. You are an important figure, and you play an important role of support in this process. To the students, congratulations on being at one of the finest institutions. I see you not only as students, but I see you well beyond your current roles. I see you as the next generation of healthcare practitioners, and I see you as future healthcare leaders. I look forward to standing by you and collaborating with you as peers and colleagues in the near future. So I want to get a little personal and share with you two short stories. The first story is about mindset. I came to the US at the age of 10, and both of my parents were never given the opportunity to attend college or even finish elementary school. We were living overseas. My parents, however, worked extremely hard to make a living to support us, and they believe that with a hard-working mindset, they can transfer that same mindset to their children. If they work hard, they would influence their kids to study hard, to replicate that behavior in school and become successful. It was not easy for them nor for us. There were 10 of us total, myself and seven siblings included, and we were often cramped into a two-bedroom apartment as we were growing up. Somehow we always found ways to make things work. We had fun growing up, and the right mindset always carried us forward. Fast forward 20 years, my siblings and I have grown up. 3 of us now are pharmacists. 3 of us now are physicians. And 1 sibling is a dentist. My parents had the right mindset and passed it on to us. I have learned from my parents that hard work ultimately pays off. One can accomplish many things, not because they were born with successful genes, but because they have the will to lift themselves up by acquiring new skills. We are not born with the skills we desired, but we can always acquire them purposefully. I trust that you will too. Believe you can, and you will. The next story is about exploring options and personal growth. I completed my undergrad at UC Irvine, but going to college was different for me. My siblings majored in biology and chemistry. I was not afraid to try new things and was willing to go beyond what was considered the comfort zone in the family. My exploration ultimately led me to pharmacy school, but it was the economics background that fostered my understanding of financial concepts. Both personally and professionally, I was an econ major. The social science background helped me realize how soft skills and social development are just as important in life. Social development is a lifelong journey, and the soft skills complement the academic skills. You need both. You see, I'm an introverted person. I did not hold any leadership role when I was in school. I was the quiet student in the classroom, but I have identified those areas as areas of growth and development opportunities for me. Recognizing and identifying opportunities is important, but what's even more important is what you do about it. Upon graduation from pharmacy school, I hit the reset button. I ventured into social gatherings where I could engage and connect with more people. I put myself into situations where I needed to talk and collaborate with others. I surrounded myself with intelligent people that I eventually called mentors. One of my mentors helped me secure a seat on the board of directors for the Orange County Pharmacists Association. I was 26 and a couple of months out of school. The power of networking, collaboration, teamwork got magnified just then. 6 months after graduation, I transitioned from a pharmacist role to a pharmacy manager role. It was a role I initially gave myself 5 years to reach. 4 years later, I was promoted to district pharmacy supervisor. It was a role I initially gave myself 10 to 15 years to reach. By then, I was in my early 30s and was trusted with 42 pharmacies to manage. I was one of the youngest district pharmacy supervisor in the nation. I have hired more than 500 interns and pharmacists for the company, and I always hire people smarter than I am. Over the next few years, I encourage you to always have a positive mindset. Study hard and acquire new skills. Be inquisitive and embrace teamwork dynamics. Invest in yourself through networking and relationship building. Seek mentorship. There will be challenging times, but as they say, quote, fall down 7 times, get up 8. Thank you.
Thank you, Dr. Nguyen. We have 2 additional speakers for the School of Pharmacy. Dr. Colleen LeLevitt, who is a practicing specialty pharmacist with a strong-willed passion for patient advocacy and a main focus on ensuring our communities receive the right medications where and when they need them. By building a strong network of practitioners, pharmaceutical partners, nonprofits, and payers, she has been able to break down barriers to patient access and improve patient outcomes. Over a decade ago, she started with Walgreens as a pharmacy technician and later transitioned into other roles such as a pharmacy intern, multi-location pharmacist, pharmacy manager, and now a specialty store manager in Orange County, California. She earned her PharmD and MBA from Hudson University. She is an active preceptor for KGI, Western, Ketchum, Chapman, and UCI. She hopes to light a fire inside all students so that they too have a burning desire to advocate for patients' well-being and safety. Our final speaker after that is PharmD student Brianna Rea. Brianna is a 3rd-year pharmacy student and current Phi Lambda Sigma president.
Thank you, Provost Prosser. Good afternoon, KGI faculty, students, family, and friends. Also, on behalf of Walgreens, thank you for allowing me to share in this special moment with all of you. It is truly with our combined efforts that we will see our profession grow and flourish. To the Doctor of Pharmacy class of 2028, hi again. So good to see you guys. I know this journey just started for so many of you, and I remember meeting so many of you at orientation. And I remember during that time, and even now, there's been so much nervousness and nerves, whether that's like butterflies in your stomach, Taco Bell from earlier, whatever it may be. Despite the nervousness, there's so much excitement. And I want you guys to hold onto this excitement. Remember that great practitioners, pharmacists, occupational therapists, PAs, we don't become great overnight. There will be trial and error, ups and downs, and that's perfectly okay. Make mistakes now while you have us to support and guide you. Test those boundaries. How we face adversity is how we become better students, better practitioners, and overall just better people. Channel that excitement, that energy into your work, and our patients and our communities will only benefit because of it. Keep this momentum going as we continue to advocate for patient care and also for our profession. Patient care is an uphill battle. We will win, and our patients will win when all of us work together. I want you to look around you, take in all these beautiful faces. This is your network, and this is your support. It is an invaluable resource, and I hope, truly hope, that you guys continue to grow it. And with that, I'd like to thank you all again so much for all of your time. Thank you so much for letting me be a part of this. Congratulations on your white coat ceremony.
Hello, everyone. Good afternoon, distinguished guests, faculty members, families, friends, but most importantly, the students who will don the white coat for the first time. My name is Brianna Ray. Like they said before, I am president of Phi Lambda Sigma, and I'm also president of American Pharmacists Association here at Keck Graduate Institute. It is a great honor to stand before you today as we celebrate the significant milestone in all of your lives. Today is a day of new beginnings as you take your first step into a profession dedicated to caring for others. Let me begin by congratulating each and every one of you on reaching this significant milestone. Your hard work, dedication, and passion have brought you here today, and it will continue to be the driving force that will guide you through these next few years. Just as you all have may felt, when I first considered applying to pharmacy school, I faced many difficult decisions. Having already earned a bachelor's in diagnostic medical sonography, I was hesitant about pursuing additional schooling. I wondered if it was too late to start a new chapter in my academic journey. At the time, I was working as a pharmacy technician, and it was during that period that I fell in love with the profession. I was inspired by the meaningful work, the supportive community, and most importantly, the amazing and inspiring pharmacists that I got to work alongside. Their commitment to patient care, professionalism, and overall care for pharmacy solidified my decision to apply. That decision brought with it the next major challenge, though, applying to and being accepted into a program. I remember feeling incredibly anxious about whether I would hear back, whether I was capable of meeting the academic standards, and whether I would even perform well during interviews. You can see I'm very nervous, so I feared that any misstep could jeopardize my chances. Standing here today, I am deeply grateful to Keck Graduate Institute for giving me this opportunity to pursue my passion of attending school at pharmacy. But I must be honest with you all. I struggled with feelings of self-doubt for the first 2 years of my pharmacy career. I often felt like an imposter, questioning whether I truly belonged and comparing myself constantly to my classmates about grades, what you got on your test, and even participating in class. I failed to take the time to acknowledge how far I had come and to appreciate my own capabilities. While these emotions may be universal and may be something many of us in the room are facing, I encourage each of you to recognize and celebrate every achievement, no matter how small, because this journey is really challenging. You had all earned your place here, and you should be incredibly proud of yourselves. The road ahead may not always be easy, but remember that you have already demonstrated resilience and determination by making it to this moment. The white coat you are about to receive is more than just a piece of clothing. It is a symbol of commitment to learning, professionalism, and above all, to the service of others. Today, as you take on the white coat, remember that it's okay to not have all the answers right away. It is okay to feel unsure at times. What matters is your willingness to learn and grow. Embrace the challenges ahead with an open heart and an open mind. Seek out mentorship and cultivate relationships with your peers and mentors. Support one another, as these connections can be lifelong, and make your time here have support, and then use the connections to inspire you through your career. And most importantly, never forget the reasons that led you to this path. In closing, I would like to leave you with the thought: you are not just future pharmacists, you are future leaders, future advocates, and future teachers in healthcare. Wear your white coat with pride, and let it serve as a reminder of the difference you will make in all of the lives you will serve. I have no doubt that each of you will make us proud. I look forward to witnessing the incredible things you will achieve. Congratulations once again on reaching this milestone. Wear your white coat with pride, as this is only the beginning of an extraordinary journey. I have no doubt that you will rise to meet it with grace and determination. Thank you.
Good morning, actually good afternoon, right? Got that one wrong all the time. Good afternoon anyway, and we welcome all of you to the ceremony. Today what we're going to do is the incoming students, we're going to welcome them both to Keck Graduate Institute, our school. We're also going to welcome them to their respective professions. What you will see, the students will receive their white coats from the faculty members, their faculty members in the program, and in return, there is a price. Students agree to accept the obligations, and there are many, for their profession. They're also going to accept the commitment to providing excellence in compassionate care for their patients. At this time, I invite the Doctor of Pharmacy faculty to come up, and please join us up on the stage. Students, please state your name and school that you attended to before KGI. We'll go ahead and start with you.
King Faisal, Muhammad Amani, University of California, Riverside.
David Oak, California State University Polytechnic, Pomona.
Ryan Wyatt, Cal State University of Fullerton.
Tony Kim, University of California, Irvine.
Tina Georges, Chaffey College.
Michelle Lin, University of California, Berkeley.
Bridget Kreuter, Mount St. Mary's University. Angela Yatanekian, Grand Canyon University.
Veda Tenang, Loyola Marymount University.
Leila Abu Samra, University of California, Riverside.
Andy Min Xun Tsai, University of California, San Diego.
Merari Villanueva Contreras, California State Polytechnic, University, Pomona.
John Ayad, Arizona State University.
Robert M. Hora Jr., University of California, Riverside.
Tyler Kim, California State Polytechnic University, Pomona.
Nandini Gopikrishna, University of California, Los Angeles.
Marian Cedra, California State University of Northridge.
Nicholas Lim, California State San Bernardino.
Delilah Valencia, Mount St. Mary's University.
Jessica Trigueros, California State University of Northridge.
Anissa Algarin Aguilar, San Bernardino Valley College.
Asia Gray, Grand Canyon University.
Nicole Evan Kula, California State University, Northridge.
Nicole Misham, University of California, Santa Barbara.
Francis Florence Versosa Alvarez, University of California, Riverside.
Beatrice Serrano, California State University Polytechnic, Pomona.
Gemma Gudino, University of California, San Diego.
Christina Deradorian, California State University, Northridge.
Hiba Javid, University of California, Riverside.
Julio Vicente Guevara, University of California, Davis.
Jonathan Califf, California Baptist University, Riverside.
this point, I am proud to introduce Dr. Kanika Bandari. She is our Assistant Professor of Clinical Sciences in the Doctorate of Pharmacy program. She is going to lead our pharmacy students in their pledge of professionalism.
Thank you so much, Dr. Bearden. The pharmacist's pledge of professionalism is a vow of professionalism, integrity, and dedication to the practice of pharmacy. By reciting this pledge today, students are reminded to embrace and develop professional values throughout their years of study and to devote themselves to provide service to patients, the profession, and to greater societies at large. Student pharmacists, I invite you to follow along with me as we recite the pharmacist's pledge of professionalism. I, Kanika Bandari, voluntarily and solemnly commit to this pledge. As a student of pharmacy, I believe there is a need to build and reinforce a professional identity founded on integrity, ethical behavior, and honor. This development, a vital process in my education, will help ensure that I am true to the professional relationship I establish between myself and society as I become a member of the pharmacy community. Integrity must be an essential part of my everyday life, and I must practice pharmacy with honesty and commitment to service. To accomplish this goal of professional development, I, as a student of pharmacy, should develop a sense of loyalty and duty to the profession of pharmacy by being a builder of community, one able and willing to contribute to the well-being of others, and one who enthusiastically accepts the responsibility and accountability for membership in the profession. Foster professional competency through lifelong learning. I must strive for high ideals, teamwork, and unity within the profession in order to provide optimal patient care. Support my colleagues by actively encouraging personal commitment to the oath of Maimonides and a code of ethics as set forth by the profession. Incorporate into my life and practice dedication to excellence. This will require an ongoing reassessment of personal and professional values. Maintain the highest ideals and professional attributes to ensure and facilitate the covenantal relationship required of the pharmaceutical caregiver. The profession of pharmacy is one that demands adherence to a set of rigid ethical standards. These high ideals are necessary to ensure the quality of care extended to the patients I serve. As a student of pharmacy, I believe this does not start with graduation. Rather, it begins with my membership in this professional college community. Therefore, I must strive to uphold these standards as I advance toward full membership in the profession of pharmacy. Thank you and congratulations.
Congratulations to our pharmacy students. time, I'm pleased to introduce the OTD Distinguished Speaker, Dr. Nicholas Vanden Heever. Dr. Vanden Heever was born in South Africa, obtained his occupational therapy degree from the University of Stellenbosch in Cape Town as the first male OT in South Africa. He decided early on in his career to develop professionally as a generalist and gained experience in a variety of settings: the military, rural communities in Africa and China, large psychiatric hospitals and industrial units, orphanages, substance abuse rehabilitation, outpatient rehabilitation, and in private practice, specializing in adult and pediatric neurorehabilitation. He spent the last 40 years in the healthcare field as a clinician, consultant, and rehabilitation director, hospital administrator in business development and marketing, and as a university professor, department chair, founding program director of both master and doctoral programs, and as a dean. Besides his international engagements, he has practiced for the last 18 years here in the United States, mostly in leadership positions as director of rehab departments, multi-site hospital-based clinics, and as a hospital educator. During this time, he obtained his post-professional occupational therapy doctorate from the University of St. Augustine. He has been an international, national, and local speaker on the topics of rehabilitation, both for the adults and pediatric population, stroke prevention, stroke, and brain injury rehabilitation, which includes functional vision and cognitive rehabilitation, and return to driving rehabilitation for the disabled. Besides his work as a consultant in the areas of quality improvement and licensing, accreditation, and survey preparation, he developed a lucrative practice in leadership development, customer service training, and developing high-functioning teams. In 2014, Dr. Vanden Heever was awarded the Occupational Therapy Practice Award by the Occupational Therapy Association of California in recognition of significant contributions to the advancement of the practice of occupational therapy. We welcome Dr. Vanden Heever.
Thank you, Dean Prosser and KGI for the honor to speak to you on this significant occasion. Excuse me. So before I start, my talk is not on the teleprompter, so I'm not going to pretend I'm not reading it. I'm actually going to read it. And because OTs are very good in environmental adaptation, you should have said that, right? I have a couple of people in the back that's going to have cue cards up for me, so if I stare back there, that's what I'm trying to do. All right, ladies and gentlemen, faculty, distinguished guests, and most importantly, our doctoral OT students. At the dawn of my 44-year career in occupational therapy, I realized that my bio is very old because it talks about 18 years. I'm at 44 now. I want to reflect a little bit on how I got here, standing here before you today. I was born the only son of a farmer. I don't know what's going on with my voice. On a remote farm in the northwestern part of South Africa. It was a sheep ranch of 28,000 acres in a very dry desert landscape. I grew up without television, internet, or video games. It's almost unbelievable. Besides school, my time as a child, I spent playing on the farm, herding sheep, and helping to prepare food for all the farm workers. I left my parents' home at the age of 6 years old to attend boarding school, which is typical in Anglo-Dutch tradition, and also because our farm was like 100 miles from the school. My folks struggled due to long periods of drought on the farm, but they valued education, and despite their financial difficulty, provided university education for both myself and my sister. I always wanted to become a physician, a psychologist, and an artist. And my mom was smart enough to say, that's not possible. So back in 1979, she came up with this crazy but thoughtful idea for me to become an occupational therapist, which ultimately combined arts, psychology, and medicine. Choosing this profession, together with my own personal challenges at that point, provide me with a plethora of obstacles, but also tremendous opportunities, such as the opportunity I had in the early 90s with the World Health Organization to establish grassroots level rehabilitation in the Republic of China. I had severe sensory integration and learning disabilities, which made university very hard for me. As mentioned, I was the first occupational therapist in the history of South Africa, and for me, being in medical school was quite a challenge, because in those days, the OT students wore mint green uniforms. So there I was amongst all the medical and dental students and pharmacy students in a mint green uniform. Funny. I just got this image. Sorry. Anyway, but I finally made it to the United States, where I was going to come and work for 2 years, and it's now 30 years later. And in this time, I overcome a lot of challenges. I started off being an entry-level OT. Before I even got my license, all my work had to be co-signed. I went to rehab director, supervisor, program director, hospital administrator, and at 51, I got my doctoral degree, and I became dean, and I established 3 OT programs. So if I look back at that, I think I beat the odds. Anyway, and why am I telling you this? I'm telling you this because I want you to believe that you can do the same. You can beat the odds, each and every one of you. Every career dream you have is possible. The profession will provide you with every opportunity you need to do so. Today it really marks a milestone in your journey as occupational therapy students. The white coat you are about to receive symbolizes not only your entry into the healthcare field, but also your commitment to resilience and lifelong learning. As you don this coat, remember it embodies your dedication to improving lives, and not only of individuals, but also of communities and populations. As future occupational therapists, you are entering a profession that is fundamentally about empowering people. While many might envision OT as strictly in a medical setting, your role expands far beyond the walls of hospitals and clinics. At the core of the distinct value of occupational therapy lies its client-centered and holistic approach to health and wellness. You will engage with diverse populations, promoting health not just on an individual level, but also within communities. You will now be wearing not only a white coat, but a multicolored coat, a coat matching the fabrics of the communities you serve. Your ability to listen, understand, and respond to the unique needs of each client will be essential. The relationships you build will be the foundation of your practice, whether you are advocating for systemic changes that improves access to services or supporting an individual in navigating their challenges. Your impact will always resonate. Embrace the interdisciplinary nature of work. Collaboration with other healthcare professionals is crucial. By sharing insights and expertise, you will create more comprehensive and effective interventions. Always remember that the best outcomes arise from a team approach where every voice is valued. As you move forward, remember that you have the power to inspire and uplift those around you. The challenges you will face are significant, but your education here at KGI, your passion and commitment will equip you to overcome them. The journey will not always be easy, but it will be immensely rewarding. In conclusion, congratulations on reaching this important stage in your career. As you wear your multicolored coat, wear them with pride, knowing that you are part of a profession that changes lives for the better. Thank you, and I wish you the best.
Thank you so much, Dr. Vandenhever. We have 2 additional speakers for the OTD program. Dr. Vikas Sharma serves as the program director for the Doctor of Occupational Therapy here at KGI. He has been an occupational therapist for 30 years. After moving to the United States in 1996, Sharma primarily worked as an occupational therapist and as a director of rehabilitation in skilled nursing facilities. The majority of his work experience is from skilled nursing facilities, adult daycare centers, and an integrated school setting. In 2013, he enrolled in Pennsylvania's Chatham University, receiving his doctorate in occupational therapy. His motive was to pursue teaching, to give back to the profession. He soon moved into academia, becoming a full-time professor in December 2015, and then later became the program director for the occupational therapy program at the same university. In September 2022, he joined the KGI family. He is very excited to educate our new generation of future occupational therapists and see them grow both personally and professionally in the field of occupational therapy. And then our final speaker for OTD is student Sarah Skinner. Sarah is a second-year OTD student. Welcome, Dr. Sharma.
Thank you, Provost Prosser. First of all, my greetings to everyone. It's good to see everyone here today. So my name is Dr. Vikas Sharma, and I'm the program director for the Occupational Therapy Doctorate program here at KGI. And today, I'm very honored and privileged to stand in front of you for this white coat ceremony event for our different programs. So congratulations and welcome everyone. First, I would want to acknowledge our occupational therapy doctoral students, the class of OTD 2027, who will be getting their white coating done today, a proud moment for all of us. Let's give them a big applause. This special event will mark their entry into the profession of occupational therapy and their lifelong service and commitment to serve as occupational therapists. But before I go further into the details of celebrating this moment, I would like to go a little bit about the history, talk to you about the little bit history about the white coat ceremony. So although white coat have been the most prominent symbol of the physician since the development of aseptic surgery in 1889, and then by 1920, they became a powerful and iconic symbol of the physician as a medical scientist. But it was not until 1993 when Dr. Arnold Gold from Columbia University College of Physicians and Surgeons developed this, further emphasizing the importance of humanism in the care of all the patients. This white coat tradition was then further expanded to other healthcare professions, including physician assistants, pharmacists, and the schools of medicine outside the United States. So what is this white coat ceremony all about? White coat symbolizes professionalism, caring and trust, and shows that we stand together as healthcare professionals committed to providing compassionate, collaborative, and scientifically excellent care for our patients. When we enter the real world and see our patients, putting on the white coat will identify us as designated professionals, who we are, and it will also let our patients know how we can help them with our acquired knowledge and skills. Thus, when a healthcare professional wears a white coat, it not only gives that person a professional identity, but reminds him or her of their role and responsibility and what they owe to the patient, which is the compassion, respect, empathy, love, and personalized and client-centered care. So without taking much ado, I would like to end my speech by saying a quote from Dr. Kathleen Liscombe, who is the general surgeon in Houston, Texas. Congratulations. I hope your white coat will remind you of the special place you have in the lives of your patients and their families. For some, you will do big things. So again, thank you very much and enjoy the rest of your day.
A few years ago, I had the privilege of shadowing a home health occupational therapist who specializes in working with older adults. As he conducted his OT evaluations and interventions, I would observe, chat with the clients, and take notes. One day, we entered the home of a woman who had recently suffered a stroke, leaving her completely paralyzed on one side. The weight of her new reality was heavy, and she shared how discouraged and scared she felt. The OT listened with empathy, acknowledged her fears, and offered her encouragement. He reminded her that she wasn't alone, that he was there to support her. With incredible patience, the OT demonstrated a simple yet transformative one-handed technique to help his client put on her own sweater. Dressing was something that she hadn't been able to do on her own in 2 months, depending on her son for this simple everyday task that we often take for granted. We watched as she used the new technique to slip her arm through one sleeve, then the other until the sweater was on. Tears filled her eyes, and mine too. At that moment, I realized just how special and necessary occupational therapy is. It is more than just a profession. OTs help restore people's dignity, improve their independence, and give their patients hope. Good afternoon, everyone. My name is Sarah Skinner, and I'm currently a second-year occupational therapy doctoral student and the student therapy occupational president here at KGI. Today, I want to welcome, honor, and congratulate the OTD class of 27 as they begin their occupational therapy journey. Now to the class of 27, I am so proud and excited for all of you. After a year of OT school, I can confidently say that you choosing this field and dedicating yourselves to improve, adapt, and restore function to your clients is such a wonderful, rewarding decision. Now, let me be honest with you. Grad school isn't easy. You'll be uncomfortable, stressed at times, and you may doubt yourselves. But can I encourage you all today? Stick with it. You made it this far. Don't give up. You've put in so much work to be here, and I promise you all the hours, tears, and time spent will be worth it. Now, remember a few weeks back, you were sitting in anatomy, and your professor asked you all to write down why you chose to go to OT school? Well, I'm here today to read a few of your responses, to remind you why you are here and who you are doing this for. Some of you are doing this for your parents who worked so hard to help you get an education, for your friends who supported you through tough times, for your dogs and cats, for your family in Utah, for your love for this holistic field, for the relatives that have passed on, and for the loved ones who maybe suffered injuries and they didn't get the quality care that they had deserved. Others of you shared you are here to make your parents proud who came to this country with nothing, to prove to yourself you can accomplish something you set your mind to, and to help those who have similar disabilities and struggles as you. The reasons that brought you here are the same motivators that will get you through it. When things get difficult, I want you to cling to and remember your why. This commitment you are making is not only for your future selves, it's for your family, friends, and your future patients. I promise the tough times will pass, and you'll be so happy for not giving up on your dreams. As you put on your white coat, you are taking an oath as a future healthcare worker to do right by your clients, to dedicate yourselves to serving others, to hold yourself to a high professional standard, to advocate for your clients' wants and needs, to speak up for those who can't, to be a lifelong learner, and to provide client-centered care, treating every one of your patients with the same level of empathy, gentleness, and respect. Today, you put on your white coat as a student, and in 3 short years, you will put your white coat back on as a licensed occupational therapist. And thank yourselves for sticking with us till the end. I'm so grateful to have each one of you as peers, and I look forward to the day that we will stand together as colleagues. Congratulations again, OTD Class of 27, on your white coat ceremony. Thank you.
I invite the OTD faculty to join us on stage, please. Students, please clearly state your name and the school you attended before KGI. And let us proceed with the first student, please.
Catherine Rainwater, Grand Valley State University.
Madison Cannon, California State Polytechnic, University of Pomona.
Alana Humphrey, Tulane University.
Shelby Tidwell, Oklahoma Christian University.
Raj Galati, University of Laverne.
Reese Rizzo, Southern Utah University.
Daniel Moss, University of Oregon.
Justin Alato, California State University of Fullerton.
Anna Melchor, California State University, Northridge. Brooke Oyen, California State University of Fullerton. Marissa Davis, Azusa Pacific University. Diana Ochoa, California State Polytechnic, University of Pomona.
Linda Law, Cal State University, Los Angeles.
Vivian Ely Sand, California State University, East Bay.
Rachel Weiss, University of Washington.
Now I would like to introduce Dr. Callie Albright, who is the assistant professor for the OTD program, and she will explain the Pledge of Professionalism. Dr. Albright.
The pledge that we will all be taking today signifies our entry into occupational therapy, our lifelong commitment to this profession, and the people and community that occupational therapists serve. By reciting this pledge, students are reminded of their professional responsibility and developmental role, both as a student and when they are in real-world practice. OTD students, I invite you to follow along with me as we recite the Occupational Therapist Pledge of Professionalism. I, an occupational therapy student and a future occupational therapy practitioner, hereby pledge that I will always abide by the core values, principles, and philosophy of the occupational therapy profession. I will follow the OT Code of Ethics and deliver the highest standards of care throughout my professional career. After completing the program at KGI and obtaining the OTD degree and license, I will demonstrate loyalty, honesty, and commitment to the profession by serving in its best interest and will always remain an ambassador and advocate for the profession. With this oath taking, I also affirm that I will work towards benefiting societies, communities, people, and organizations through my acquired knowledge and skills and helping them obtain meaningful occupations in life. Finally, as a part of my professional responsibility and development, I will keep myself abreast of all the research, current changes, and trends happening within and outside the profession and will use evidence-based practice to provide the best outcomes for the people I serve. Congratulations.
Congratulations again to our OTD students. At this time, I'm pleased to introduce the MSPA Distinguished Speaker, Dr. Lakshmi Savatala Damerla. Dr. Damerla is a physician assistant who graduated summa cum laude from Charles R. Drew University of Medicine and Science in 2001. Her educational journey, which includes a Bachelor of Science in Biology from UC Irvine, a degree in respiratory care therapy from Loma Linda University, and an executive MHA in health administration from the USC Sol Price School of Public Policy, has laid a strong foundation for her diverse experience in various medical specialties, including pediatrics, internal medicine, urology, and hematology bone marrow transplant. Additionally, she earned her Doctor of Medical Sciences from the University of Lynchburg, further enhancing her expertise in clinical trials and operations and contributing to numerous peer-reviewed journals. Beyond her clinical expertise, Dr. Damerla is passionate about education and mentorship. She has taught at various institutions and has held affiliations with notable hospitals such as Huntington Hospital, Arcadia Hospital of USC, USC Norris Cancer Hospital, and Keck Hospital of USC. As a clinical instructor of medicine at USC, she played a pivotal role in shaping the next generation of healthcare professionals before transitioning to an administrative role at Cedars-Sinai. Currently, Dr. Damerla serves on the advisory board for the KGI MSPA program, where she is instrumental in identifying clinical sites and interviewing prospective students. Committed to the PA profession, she is dedicated to ensuring that future PAs receive the comprehensive training necessary to understand their significant impact on the healthcare system. Welcome, Dr. Damerla.
Good afternoon, ladies and gentlemen. Dean Prosser, KGI President, KGI faculty, family members, and mostly the wonderful group here, the KGI students. It's my privilege and an honor to be invited to be a keynote speaker here for your white coat ceremony. Take a moment and reflect on how long you've thought about this moment. Wearing that proverbial white coat, putting on that stethoscope, walking into that patient's room. I'm sure a lot of us, when we were kids, kind of toyed with white coat, but this is real. Officially transitioning to patient care. And the white coat is a true embodiment of professionalism, trust, and responsibility. I'm just curious, how many of you are actually nervous about starting your clinical journey? Right? That's pretty normal, and for those of you that didn't raise your hand, I'm sure you are nervous, and rightfully so. It's okay, allow yourself these feelings. Like Colleen said, make your mistakes now. Over time, I guarantee you, you will get over it. I wasn't quite as nervous when I started my clinical rotations, but I will tell you, when I first took on my first job, I literally would say a prayer before I went into each and every patient's room. I'm like, please, let it be something simple, like, I don't know, a ear infection, urinary, UTI, URI, something simple. I didn't want to walk into a complex situation. So you will get through it, as all of us have. You will soon realize that as a provider, your role doesn't end with just seeing patients. You have to complete your notes, put in your referrals, you return patient phone calls, refill prescriptions, so on and so on and so on. My plea to you is don't fall trapped to being a robotic provider. Bear in mind that the few minutes you are in that patient's room, your responsibility and your focus should be your patient. Everything else should wait. Reflect on this for a moment. According to National Literacy Institute, in 2024, 21% of adults are illiterate. 54% are at 6th grade or below level. 20% are at 5th grade level. Mind-boggling numbers. And when I looked this up, I was startled. So moving on to health literacy, that number is even more jarring. According to Milken Institute and Center for Healthcare Strategy, 9 out of 10 adults struggle with health literacy in the United States. So don't make assumptions about your patients. So our ability to educate and empower our patients becomes that much more crucial. So how do you do it? Well, it's simple. What I mean is keep it simple. So when you walk into a patient's room, leave your medical terminology at the door. Yes, we all know you probably aced medical terminology. You don't need to show it off with your patients. Keep it simple. Avoid words like, oh, your hypertension is out of control, your hyperglycemia, your hyperlipidemia, whatever fancy words you want to use. Mr. John Doe, your blood pressure is high. Your sugars are low, your cholesterol is high. The less you complicate it, the better you are to connect with your patients, develop that connection, and ultimately gain their trust in you. Secondly, advocate for your patients. And patient advocacy comes in several forms. And it could be just as simple as appealing a medication denial, doing a peer-to-peer for that scan that you ordered. It can come in so many forms. I have personally taken patients that get referred outside, called the referral place with the patient in the room to make appointments. You just don't know what you are dealing with, right? So for us, you realize the ever-changing landscape of healthcare, the complexity of healthcare delivery in the United States. It is so complex. That's us as providers that do this on a day-to-day basis. So imagine that for your patients and their families, how daunting and difficult that must be. So I beg you, take the time with your patients. Help them navigate through their journey. Your role is to provide care with compassion, yes, with responsibility, respect, and diligence. So when you go above and beyond for your patients, yes, you will all leave here because KGI has provided you a great education, all being good providers. But set yourself up to be a great provider. So I leave with you a few principles that I've kind of gone by. Listen, listen, listen. Listen and understand your patients. This enables you to focus on them as a whole, understand their beliefs, understand their background, their limitations. You would be surprised that extra minute that you spend in that room, what you are able to glean from them and understand with them. Respect. Treat them with respect. Sure, you have 20, 30, 40 patients waiting, but they've equally been waiting for you, probably for several months to get into your office. Allow them the time in the room. One of my biggest pet peeves is, with technology is great, good, bad, we can have a discussion about that anytime. However, my biggest pet peeve is you walk into a patient's room, there's this big computer in front of you, the patient is sitting there, and what do we all do? Open at that computer. We're essentially talking to the computer. I don't like it one bit. I don't like it as a patient. I don't like it as a provider. Cultivate yourself to connect with the patient. Make eye contact, and then take the time to do your notes, whatever else you have to do. As students, initially it's going to be hard to remember what you said to the patient or what happened. Sure, initially as you get yourself up, it's okay, but once you are develop that connection with your patient. On a final note, you are the next generation of providers. It's incumbent on you to take charge, lead, innovate, and most importantly, give back to the community. Take time to mentor, volunteer, teach, keep learning. Most importantly, be curious. I promise you're not going to kill any cats with that curiosity. I stand before you as somebody who took some chances. After graduating, I got called in to fill in for clinical research. I had no idea what this entailed. They just said, hey, come be a sub-investigator. I'm like, a what? So I have learned, just by being curious and open, what clinical trials is. How do you conduct clinical trials? How do you write a protocol? What is an FDA approval? So allow yourself, don't be afraid to take chances. So on that note, thank you once again for inviting me to be a part of your special day. Congratulations and best wishes to you all.
Thank you so much, Dr. Damerla. We have 2 additional speakers for the PA program. Professor Stacy McElroy is an assistant professor in the MSPA program. She joined KGI in August of 2021 as principal faculty. Professor McElroy is a proud graduate of Claremont McKenna College from 1990, earning her bachelor's in political science and economics while playing basketball for all 4 years and softball her senior year. After a brief time in healthcare consulting, she became a paramedic firefighter to gain clinical experience while taking prerequisite courses in preparation for PA school. In 1999, McElroy earned her Master of Medical Science in Physician Assistant Studies from Midwestern University, Arizona, and has since worked as a PA in urgent care, trauma services, ICU, and orthopedics. She worked in orthopedic surgery at Mayo Clinic for 10 years and ICU at Mayo for 2 more years, obtaining extensive experience in orthopedics, orthopedic oncology, and soft tissue tumors, as well as intensive care. She then worked in level 1 trauma at Chandler Regional Medical Center for 2 years before moving back to California, where she has been employed at Kerlan-Jobe Orthopedic Institute at Cedars-Sinai as an orthopedic surgery PA since 2019 and continues to work clinically 1 day per week. Professor McElroy has over a decade of experience as a PA instructor, serving as an orthopedic surgery preceptor for the Mayo College of Medicine. She presented at multiple grand rounds and primarily focused on topics of surgical first assist, perioperative management of orthopedic inpatient, outpatient medical needs, and acting as a patient's first consultant in an emergency department to medical students and residents. She also mentors new PAs at Kerlan-Jobe and is excited to bring her expertise to students at KGI. She is passionate about KGI PAs who will make a difference in healthcare delivery as well as healthcare policy. Our final speaker for PA is MSPA student Kirill Lipa, who is a third-year student in the Chan Family Master of Science in Physician Associate Studies.
You were talking about. That's a lot of stuff. I'm reading also, so first I want to welcome all the friends, family, and faculty here to honor our white coat recipients. Thank you for taking the time to be here and mark this occasion. It's a fun day to celebrate the culmination of all the didactic work these remarkable PA students have accomplished and the beginning of their journey into clinicals. In celebrating this day, though, I want to tell you a little bit about why this particular group of PA students is special and why this program has challenged them a little differently than possibly other PA programs may have. I don't know if you've heard, but there's an election coming up. There's a multitude of issues in the zeitgeist of this election, one of which is the US healthcare system. Regardless of where you fall on the political spectrum, we can all agree that our healthcare system is less than ideal. Truly broken, if we're being honest. Very difficult to navigate on the best of days. Expensive. The GDP expenditures of the U.S. The GDP expenditures of the U.S. on per capita healthcare is 5 times that of any other industrialized nation, and that translates to some of the worst outcome data of any industrialized nation. This diatribe isn't new for this very astute group of PAs. We have essentially predicated their already difficult PA educational curriculum with the foundational belief that they will become part of the solution to this complicated problem. They've all heard me say this more than they care to admit, but I have told them that any program would have been adequate for them to become PAs. All of you are tremendous individuals, and you have such unique gifts within each of you that will make you great clinical PAs. The difference here at KGI, however, is we've asked you to become leaders in the healthcare delivery system, and we feel we are truly equipping you to be the drivers of change in the healthcare delivery system itself. This is baked into our mission statement, and it's not just something we pay lip service to as faculty and an outreach team. We have asked these students to study healthcare economics, political and social determinants of health, and to be apprised of legislation on top of clinical medicine, pharmacology, anatomy, and so forth. We feel so strongly about creating the next generation of healthcare leadership that we created an opt-in leadership academy on top of all the compulsory curriculum to address personal leadership and issues uniquely facing the PA profession, specifically so these students can be equipped to emerge as adept leaders in the very diverse healthcare space. Note that I said opt-in. And in this group of students, essentially all opted in by giving up lunch hours, staying late, doing extra work. And I do have to say this has been one of the truly most rewarding experiences as a faculty member to be leading this academy and seeing the dedication and commitment of this group to not only be exceptional clinicians, but to becoming, to be exceptional clinicians, but to be leaders in their respective fields and finding the way to best utilize their personal gifts to actualize this leadership. So we all know PAs are uniquely poised as clinicians in the delivery space to be change makers, given our ability to be nimble within our clinical fields and change specialties. Our collaborative care model and team-based care is kind of baked into our clinical DNA. However, what I want to reiterate with all of you as you demarcate this milestone of completing your didactic curriculum and move out into clinicals is that all of you have such remarkable and unique gifts. And each of these individual gifts is what's going to allow you to connect with your patients and be exceptional clinicians. We see you, and we applaud just how amazing each and every one of you are. As you all know, I don't believe in wishing you luck. I believe that you've made your own luck. Luck is merely when preparation meets opportunity, and in the words of great John Wooden, right? You have been prepared and your opportunity abounds. We are so excited to see where you go. So in closing, I wanted to share a speech that was made in the movie Coach Carter, which when I watched this movie on a plane recently, I thought of all of you immediately, and when I share it with you, I think you'll realize why. So I'm going to try to get through it. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. Your playing small does not serve the world. There is nothing enlightened about shrinking so that other people won't feel insecure around you. We were all meant to shine as children do. It's not just in some of us, it's in everyone. And as we let our own light shine, we consciously give other people permission to do the same. As we are liberated from our fear, our present automatically liberates others. So class of 2025, go shine bravely and brightly. We are so deeply proud of you. Thank you.
That's tough to follow up. Hello, everyone. My name's Kirill. I'm one of the class of 24. And first off, I want to give a huge thanks to the Keck Graduate Institute for allowing this white coat ceremony to happen, because this is a huge milestone for us to start our clinical phase. Huge thanks to the faculty sitting over here. They're the reason why we have such a great quality of PA students sitting here before us today. But to understand how truly great they are, we have to talk about how this all started. These students had to pick up where me and my inaugural cohort left off. We went through our trials and tribulations, and now it's your turn to pick up where we left off and carry the flag forward. Okay? This PA class will be the first to go through what the program has been envisioned to be. My class and I, we were the first child. Family in the back, you understand what a first child is. It's a trial by fire. The grown-ups got it all right now, and they're making all the right decisions for them. I can only imagine how tough the faculty is on you, though. Their expectations rose. They demanded more from you because they saw what we could do, and why not achieve even more greatness with you guys? That's because this is not the average PA program here that only wants to make sure we pass our board exam. Yeah, that's super important too. But moving on to the clinical phase, it's not all about the book knowledge. It's applying it. Can you make a difference in that room? Can you be useful? That's us, as us students, you know, like we gotta make sure we're doing something, not getting us in trouble though. Can we put all that knowledge into practice? Clinicals will also test your character. Can you be a good person when life is tough? Because goodness is a choice that we need to make over and over and over again. You can't check it out at the door before we go into that patient's room. Clinicals will test your integrity. Can you do the right thing when no one is looking? Clinicals will test your why. Why are we even doing this to ourselves? Your why will propel you on those exhausting days. Your why will get you through those tough times. Your why will push you to achieve greater heights than you've ever dreamed of. So class of 25, are you ready for this next challenge? All right, yeah! So we all have our whys for becoming a PA. The day I knew I was going to become a PA was when I got to work with one incredible Army PA. He excelled because he didn't have to make superficial impressions on people or a fake it till you make it attitude. He excelled because he was a provider that had undeniable proof through his actions, through his work, and I wanted to become just like that provider. That same Army PA, he was chosen to give a speech to a group of combat medics that persevered through one of the most challenging competitions in the U.S. Army. I was among the group of combat medics who endured a grueling 72-hour straight competition. Each medic volunteered to be in this competition. Each medic could choose to leave and quit at any moment. Now, the few that did not quit reaped this one reward. He asked us, are we cubic zirconia or are we a diamond? Now, I had no clue what a cubic zirconia even was. I'll break it down for you. It's a fake diamond. But nothing's wrong with a fake diamond if we're talking about rings on our fingers. But we're not talking about rings, are we? We're talking about a great group of individuals sitting before us here today. These individuals all volunteered to be on this adventure. These individuals were mentally and physically pushed to a limit that they have never been pushed before. These individuals never quit, even under immense pressure. We are not the same mass-produced shiny rocks that are made in a lab somewhere that eventually lose their shine and have to get replaced. The fake diamond wouldn't be able to handle the pressure that we've gone through. That pressure of leaving our comfort zones, that pressure of distancing ourselves from our hobbies, our friends, and our loved ones. The pressure from didactic year that demanded everything from us. Here's all of medicine, they said. You have 1 year to learn it. All of it seemed like an impossible task. If we were fake diamonds, we would have crumbled already. Each diamond is unique in its design. Everyone has a different view of its shine. Each and every one of our patients will have a view of that shine. So the beauty of a real diamond is in its imperfections. During clinicals, you will be humbled. The perfectionist mentality is not sustainable. Trust me. Clinicals is where we take that knowledge that is airport baggage stuffed into this brain, and we got to put it into practice. Class of 25, right now, all this weight is on your shoulders. The weight of passing these endless exams, the weight of proving yourself to seem like you're not that imposter. That day that Army PA gave us that speech, he told us that he only saw diamonds among us that were forged under immense pressure, and that is exactly what I see sitting in front of me here today. Trust me, trust your faculty, and more importantly, trust in the support of the loving family and friends that are sitting behind you. Let's brush off that weight off our shoulders, let's put on these white coats, and shine like the true diamonds we all are. Thank you.
Thank you so much, Kirill. We could not be more proud. At this time, I would like to invite the MSPA faculty on stage so we may don the white coats of our MSPA class of 2025. Students, please clearly state your name and the school you attended before KGI. Let us proceed with the first student.
Andrew Samir Yagnam, California State University, Northridge.
Enoch Lee, University of California, Irvine.
Jeff Castillo, California State University, Long Beach.
Jeremiah Jones, California State University, San Bernardino.
Ashleen Kaur Sodhi, University of California, Davis.
Chizoba Okadobi, University of Oregon.
Natalie Milstead, San Diego State University.
Emily Sun, University of California, Los Angeles.
Edmundo Medina, University of California, Riverside.
Zarian Omari Williamson, California State University, Monterey Bay. Go Otters.
Vincent Yu, University of California, Santa Cruz.
Pinkesh Katariwala, Seattle University, Washington.
New Tien Kim Huynh, California State University, Long Beach.
Cecilia Landy, University of California, Santa Barbara.
Maggie Bear, Marquette University.
Cameron Jones, Cal Poly San Luis Obispo.
Vincent Bryce, Grand Canyon University.
Bryant Lim, University of California, San Diego.
Roxanne Mahadine, University of California, Riverside.
Andrew Wynot, Excelsior University.
Olivia Arabit, University of California, Santa Barbara.
Lindsay Anderson, Texas Christian University.
Rachel Elizabeth Gray, Indiana University.
Serenity Essence Patterson, California Baptist University.
Julie Hanawa, University of California, Berkeley.
Jasmine Ventura Pacheco, University of California, Riverside.
Connie Lee, University of California, Los Angeles.
Heidi Kafuir Celestino, University of California, Los Angeles.
Caroline Nada Park, University of California, Davis. Katie Tao Huynh, University of California, San Diego. Miranda Sarmiento, University of California, Riverside.
Madison Duckworth, the College of William & Mary.
Brianna Alvarez, University of California, Riverside.
Rona Jean Lynn Texan, the University of California, Los Angeles.
Royale Raouf, University of California, Riverside.
Flora Salette, Santa Clara University.
Ida Bagai, University of Houston.
Swara Modi, University of California, Riverside.
I would now like to introduce Professor Bill Sullivan. He is an MSPA assistant professor, and he will be explaining the Pledge of Professionalism.
Thank you, and welcome everybody. So this pledge we will all be taking today signifies our entry into the profession of physician associate, our lifelong commitment to this profession, and to the people and communities that physician associates serve. By reciting this pledge, students are reminded of their professional responsibilities and developmental role, both as students and when they enter real-world practice. MSPA students, I invite you to follow along with me as we recite the Physician Associate Pledge of Professionalism. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, benefits, non-malfeasance, and justice. I will recognize and promote the value of diversity. I will not discriminate. I will treat equally all persons who seek my care. I will hold in confidence the patient-specific information shared in the course of practicing medicine. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will assess my personal capabilities and limitations, striving always to improve my practice of medicine. I work in the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to a healthy health. I will respect my professional relationship with all members of the healthcare team. I will share and expand my clinical and professional knowledge with PAs and PA students. These duties are delegated with sincerity and upon my honor. Thank you.
Wow, what a great day to be a Beaker Bee. Another round of applause. Dear students, today you have taken and affirmed a solemn oath that marks the beginning of a lifelong and rewarding journey in honored and trusted professions. This journey will be characterized by dedication, hard work, extensive and deep learning, and profound professional and personal growth. On behalf of the entire KGI, faculty, staff, and Board of Trustees, we extend our heartfelt congratulations to each of you. We wish you immense success on your educational journey and are excited to be a part of your continued growth and learning. As you step into the healthcare profession, you are joining a noble vocation and becoming a part of a caring and supportive family, the KGI community. Remember that we are here for you, fully committed to your success. Your accomplishments are a source of great pride for all of us. At KGI, we are committed to elevating excellence together, and everyone in this room will play a major role in making that happen. As such, let us come together with enthusiastic applause to congratulate our PharmD class of 2028, our OTD class of 2027, and our MSPA class of 2025. Your dedication and hard work have brought you to this momentous occasion, and we are so excited to witness the bright futures that await each of you. Congratulations and best wishes for the remarkable journey ahead.
So this marks the end of our ceremony. Congratulations again to all of our students. Families and friends, we are going to hold on to your students for a little while to take some photos. And we're going to ask that you don't come to the stage to take photos so we can expedite that process. But we do invite you outside to a reception, and our students and faculty will join you very soon there. Thank you again so much for joining us, and all the best to our students.